Real reform will mean reductions in our long-term budget. And I've made a firm commitment that health care reform will not add to the federal deficit over the next decade.
That was President Obama this weekend continuing his push for an overhaul of our health care system. And we're back now with Britt, Mara, Bill, and Juan. So, Britt, as the debate over health care reform heats up, do you sense that the president and the Democrats are gaining momentum or losing momentum?
They're losing momentum, but they were inevitably going to, and we got down to the particulars of this. It was one of the reasons why they were so hesitant to say anything very specific about what exactly was going to be proposed. And the reason is obvious. Every idea you have, every plank in this platform, if you will, has its supporters and its opponents. And the opposition is now forming and coalescing. And the other problem the administration has is it doesn't have any money. That we're already committed to so many other things, and the deficit, which is becoming a more and more potent political issue, is a big problem too. So hence you had the statement that he made, which I think is pie in the sky, about how it's not going to add anything to the deficit. It's bound to, if it indeed passes in the kind of form that he's proposing. So I think it's in some serious trouble.
Serious trouble. In
terms of anything on the scale that he is talking about, where you insure all the uninsured, you have a public option, and all these ideas that have been at least tentatively embraced by the Obama.
Mara, do you buy that?
I think there were always two really, really big obstacles. One was how you pay for it, and one was whether or not there would be a public plan. Up until this week, I always thought the public plan was the bigger obstacle.
And then let's just explain. We're talking a public plan means that there would be a public option.
Yes, an alternative to private insurance.
Government
insurance, a Medicare-style plan that would compete with private insurance plans. I think there's been actually some movement on that. You heard today, Senator Dodd and Chuck Grassley talking about this co-op idea, which wouldn't be public, wouldn't be run by the government. It would be a non-profit cooperative like agricultural cooperatives that would still compete with public plans. But it wouldn't be government run. I mean, still compete with private plans, but it wouldn't be government run. And Max Baucus really likes it. And that seemed to be, at least for the moment, until the details are delved into, seemed to be providing some kind of consensus. I think paying for it is turning out to be much, much harder. I mean, you heard Senator Dodd absolutely saying it's no-go on taxing these gold-plated health care benefits that a lot of people get. The problem is that the savings that are scorable, that the CBO will actually count towards savings, are politically really difficult. And the things that are politically easy and are vague, like innovation, making these health delivery systems more productive, are impossible to score. I think this is a tough nut to crack, and I do think what Senator Grassley said is important. The president is going to have to break this logjam, and it's going to involve climbing down from some campaign promises, which is not to tax people under $250,000.
Well, if he wants to tax people under $250,000, good luck. Let him try to explain to the American public why, when he's raising taxes anyway next year and the year after, that's pretty clear, and we're in a recession, and we have a huge budget deficit, that we should spend $1 trillion and tax people in middle-income brackets for very speculative health care gains, which I think, in fact, would lead to rationing and would be a diminution of the quality of health care. I think Republicans could win this fight. It won't be Republicans. I think opponents of the health care plan could win this fight, with Democrats deciding this whole package is a bad idea. The government plan is, I think, a ridiculous idea. The co-op is a fairly ridiculous idea. Hey, if a co-op's a good idea, set up a co-op.
Yeah,
if they all think there's no law against setting up new insurance plans in the United States. If people want to do it, if people want to do it cooperatively, they can do it. Why does the government have to spend $1 trillion? So I think that goes. I think the taxes are a big problem. Spending is a big problem. I think for the first time, not just parts of the whole plan could be defeated, but people could decide, you know what, this is not the moment for a radical overhaul of 1/6 of the U.S. economy. Let's get out of the recession. Let's do some other sensible things, maybe some small insurance reforms, and let's revisit this in a bipartisan way after 2010.
It'll never happen. If you wait, it'll never happen. As President Obama said, now is the time. The moment is now.
Why is that?
And the time is now because as you approach 2010, then the power of big money, and big money coming from the insurance companies that are particularly threatened by this proposal, will be all over the table. And we will be back to the paralysis that has prevented any kind of health care reform in this country for all time. It's the reason we have so many uninsured. It's the reason we had kids who were not getting care. It's the reason people are clogging the emergency rooms. So here comes the moment to do something, and everybody says, no, well, we should just wait. Look, I think what you heard from Chris Dodd this morning is let's talk, let's negotiate. But the idea that you would say no, or that you would say, oh, well, people can form co-ops anytime, if they were going to form the co-op, they would have done it. Obviously, there's some disincentive, and this is a moment for the government to act aggressively and affirmatively in terms of caring for the American people.
You know what, the last
that argument has not been made yet. And I think that argument has to be aggressively made by the president.
You haven't heard the president?
I think the president hasn't gotten out there and sold it. That's why this week, I believe he's giving a speech tomorrow. He's going to aggressively begin the salesmanship.
No, he's been aggressively selling this. The question is, the last health reform fight that Bill was involved with, that's what happened. The whole thing collapsed of its own weight, and then they turned their attention to S-chip, little incremental changes. I think the winds are stronger behind health reform this year than they were then. And I do think there are other ways to make it slightly less expensive. Maybe you don't cover everybody all at once. Maybe it's incrementally rolled out. I mean, there are ways to make it more digestible. I think they've come an awfully long way. You've got Congress really working on this in a bipartisan way, which you didn't have 15 years ago.
Tom Donahue, off camera, said, we really do want a health care plan. Now, they don't want a lot of the president's plan, but I think a lot of businesses would really...
They might pass some pieces of this. I say, let's hear it for co-ops. Co-ops are a wonderful idea.
What about an individual mandate?
Let's do co-ops first, because they're... You know why? Co-ops are essentially harmless. I mean, there's nothing wrong with that idea. It's a good idea, and it doesn't do any real damage. Individual mandates, for an old guy like me, I say great. That's more young people paying into the system to help pay for my health care.
When he says he wants health care, doesn't that suggest to you it's important to the American economy?
No, it suggests to me it's important to big business. The big auto companies were for the Clinton health care plan. It's small business and individuals who get clobbered.
This is why Panel Plus was invented. Gentlemen, thank you all. See you next week. I said it again. And lady.